off your schedule. Always keep the home health agency informed. If you're getting behind, let them know immediately. It's possible that someone else may be able to go and see the patient that you were supposed to see in your next visit, or at least it would show respect for the home health agency to call the next individual to let them know that you are going to be running a little bit late. Avoid getting bogged down in tasks that are not part of your assignment. For example, you would not, even though it might be nice to do, you do not have the time to do any heavy housekeeping, things like cleaning their closets, washing windows. Those are all things that would be over and above the responsibilities of the home health aide. Care needs, provisions in the home need to be adapted from what they are in the hospital or long-term care facility. As you know, the medical equipment that is used can be extremely expensive. Many patients do not have the resources in order to be purchasing these kinds of expensive items. For example, in a hospital or long-term care facility, there are very expensive shower chairs that you will have access to because they're used on more than one patient. Instead of purchasing expensive shower chairs, in the home, frequently what may be used would be a very inexpensive plastic chair, and that would be able to be placed inside the shower for the patient to sit on. The particular shower chair that's shown in this picture cost $5, and as a result, you can see it could do the same thing as providing a safe place for the person to sit as the more expensive items might be. Another adaptation might be in the placement of a barrier for the medical bag that goes into the home. In some instance, you might use chucks or another barrier that is more expensive. Newspaper or a paper towel that might be in the home or that you take with you in the medical bag can work just as well and help limit the cost of the barrier. Another thing that you can adapt in the home is the waste basket liners. Some of the liners that you'll use in healthcare facilities are expensive. In the home, oftentimes they will just use bags that have come from stores, grocery stores, or department stores, and it works just as well. Another adaptation might be in a cold compress. Rather than the costly cold compresses that you may be used to in a medical facility, sometimes in the home, frozen peas or other frozen item can be used as a cold compress with the same high quality results. In addition to a nurse and nursing assistant coming into the home, there are many other disciplines that are involved in home health care. Some of the professionals that come into the home might be a physical therapist. A physical therapist may come into the home to help with gait training or muscle strengthening following a hip fracture or knee repair that an individual might have had, or maybe they've had a stroke and they need some assistance in gaining muscle strength again. There might be occupational therapy coming into the home to assist in activities of daily living. Some of these activities of daily living might be assisting the person to know how to work in a kitchen setting again, how to work with buttoning their buttons or other grooming kinds of activities. Another professional that may come into the home might be a social worker. A social worker is able to let the patient and family know of resources that are available to them. Things such as respite care, so that the family can get some assistance, temporary assistance for the patient that they're primarily caring for. A social worker might be able to provide for Meals on Wheels and so forth. And another professional might be a chaplain service that would come in at the end of life for a patient to assist with patient and family for those particular hospice needs. Assisting patients in their home can be a very challenging experience. Knowledge about ways to ensure your personal safety as well as the patient's, maintain a clean, comfortable environment, and work effectively with patients and families can make being a home health aide a very rewarding career.